Donald Trump's statement at his weekend rally in Tulsa, Oklahoma, that he asked officials to slow the testing down to improve the numbers was a reckless statement. It wasn't the first time he's been reckless, but it may be his most critical time. He's now garnered backlash from health officials and Democrats. This same day Trump made this statement to his rally crowd, 8 states reported their highest ever single-day case totals. During his rally, he referred to COVID-19 testing as a double-edged sword. He added, "Here's the bad part, when you do testing to that extent, you're going to find more people, you're going to find more cases." The president then added the punchline, "So I said to my people, slow the testing down, please." Looking at it as a scoreboard is the wrong way to think about it, said infection disease expert Amish Adalja of the Johns Hopkins Center for Health Security. To think of it as something you can manipulate or slow down based on what the numbers look like speaks to a complete misunderstanding of what an infectious disease response should be. Trump's team worked damage control on Sunday. His chief trade advisor, Peter Navarro, said the comments were tongue-in-cheek. Another official told the Washington Post Trump was joking, the same thing that was said when he suggested people inject themselves with bleach to heal from the coronavirus. Acting Secretary of Homeland Security Chad Wolf said on CBS News' Face the Nation that the president's comments were rooted in his frustration with the press. Instead of focusing on the actual progress that this administration has made in revamping an antiquated testing system and testing record millions of Americans, they're focused just on the rising case numbers, he said. It would seem that would be the focus for most people, to focus on rising cases of a fatal virus. One senior official described Trump's statement as a political albatross, adding that administration officials and the vice president have been trying to convince the public that Trump is working hard, trying to quickly end the virus. But Trump already played his hand. There is no taking it back. An administration official with knowledge of the discussions said Trump had been focused on the increased testing capacity so he can boast about the increase. Recently, Trump made an obvious effort to play down the virus and move on to other topics, noted 2 officials. But now no one's moving on, and everyone is only focusing more attention on it, so this was bad strategy if that was his goal. House Speaker Nancy Pelosi, DCA, said in a statement on Sunday that the American people are owed answers about why President Trump wants less testing. Testing, tracing, treatment, and social distancing are the only tools we have to stop the spread of the coronavirus, but President Trump orders his administration to slow down the testing that saves lives, she added. Trump likes to say the pandemic is nearly over, even as the country confirms more than 20,000 new cases daily, and the death toll lurches past 118,000, calling outbreaks that arise embers, wrote Mike Pence in an op-ed last week. He said there was no second wave and bragged about the progress of the administration in their fight against the virus. He also blamed the media for making the threat of a second wave out to be more than it was. "We're still really early in this pandemic, and it is not helpful to create a mindset that we're almost done," said Ashish Jha, the director of the Harvard Global Health Institute. "It's part of what we're seeing in terms of large outbreaks going on in Arizona, Texas, and Florida, is people have gotten convinced the pandemic is over. Every expert agrees that testing is the bedrock of both surveillance telling how the epidemic is progressing and control finding and isolating cases," said Mark Lipsitch, the professor of epidemiology and director of the Center for Communicable Disease Dynamics at the Harvard T.H. Chan School of Public Health. To deliberately scale back testing because it is giving a more complete picture of the epidemic is nothing less than public health malpractice. The president's comments, as well as his others, is why we are headed for a second wave and why it may be the same or worse than the first. These are all reckless. Slow down the testing, the suggestion to inject bodies with disinfectant, and appearing before a church for a photo op. These are the things voters may be remembering in November.